This is Saturday, 4th of November 2017. I'm in western Tokyo, just near Yokohama. And I've got some news today, which is that I've been accepted for a cancer treatment called Proton Beam Therapy. This is being given with the intention of curing my incurable cancer. So it's pretty exciting stuff. It's a form of radiation therapy, but it's different from most radiation therapies, which are based on photons. This is like you're using X-rays or whatever. This is using protons, which have a special property that means the energy of the beam can be deployed into the tumour much more accurately, and it doesn't come out of the back of the tumour. So proton beam therapy should damage healthy tissue much less than normal radiation treatment does, because normal radiation treatment, the beam, well, it actually goes on forever. The intensity decreases, but in theory it goes on forever. So if you're treating tumours with normal radiation, you have two problems. One, which is that if the tumours aren't close to the surface of the skin, the beam is going to damage the healthy tissue on the way to the tumours, and that's where the beam is going to be at the highest intensity, highest energy. So in my case, this treatment is to destroy 3 liver tumours. So a radiation beam would damage all the healthy tissue in my side of my body and in the ribs and things before getting to the tumours. And then once the radiation is at the tumours, it still continues out the back of the tumours, damaging more healthy tissue. Proton beam therapy doesn't work like that. The intensity of the beam peaks at a certain distance from the radiation source. So a lot more energy can be put into the tumours and almost no energy comes out the back of the tumours. So yeah, it's kind of exciting. Last week I went to the Proton Beam Therapy Centre in Fukushima in the north of Japan, a city called Koriyama. That was to have a PET scan and an MRI scan to see if proton beam therapy would be possible for me and worth trying, and also to have a discussion with the director of the centre. So yeah, proton beam therapy is quite an amazing treatment. To do the therapy, this hospital has had to build a separate building for it. Although you're in like just a small medical cubicle with a single bed in to have the treatment, you're connected to a machine that weighs about 200,000 kilograms, so 220 imperial tons. So yeah, seriously big machine. It's a linear particle accelerator. So it's kind of a super technology intensive medicine. It's going to take a couple of months to have all the treatment, so it's 38 doses. Well, in fact, it's 38 sets of 3 doses, one for each tumour. For each tumour, the blast of radiation only lasts 3 minutes, but it takes about 15 minutes per tumour because your body needs to be positioned in a certain way. For each tumour, a large custom block of brass will be cut for me to guide the protons in. So this is using a type of proton beam therapy called passive scatter proton beam therapy, which is more effective for my size of and position of tumours than other techniques of proton beam therapy you may have heard of, like pencil beam scanning and intensity modulated proton beam therapy. This is the most effective of the 3 modes of proton beam therapy for my case. So for 45 minutes every day, Monday to Friday rather, for essentially 8 weeks or something, I'll have these treatments, and my normal chemotherapy will continue just as usual, although I'll be having it at a different hospital. And I will probably, during this treatment, have to stop my molecular targeted therapy. And that's a bit scary because my molecular targeted therapy is probably very important. So anyway, exciting news. I'll be making lots of videos about it because it's very unusual, I believe, to be treating terminal cancer with proton beam therapy with an intent to cure the cancer. It's often used with palliative intent, so to extend life a bit and hopefully reduce the symptoms of the disease. But yeah, my treatment case is quite unusual, and therefore, kind of whether it works or not, it's going to be very useful to other people, because the number of people who have this is this kind of treatment for this condition is so low. So yeah, I'm glad it's going to be helpful, whether it works or not. Although obviously I'm very much hoping it works. So yeah, if you'd like to help me do some fundraising for this, please do get in touch. The treatment itself costs 3 million yen, which is £20,000, or it's about 26,000 US dollars. Quite a serious chunk of money. There are lots of very, very simple free ways that you can help me to get that money. So please get in touch if you can help me. Best way to get in touch is via Facebook. So just look for me, Matthew Dons, on Facebook, or you can leave a comment on this video. On Twitter, I'm Karamoon, Karamoon. So there's all different ways you can get in touch with me. So please do, if you'd like to help out, and there are lots of free and easy ways you can help me do some fundraising. My fundraising page is matthewdons.org, that's MATTHEWDONS.org. Thanks a lot for listening.